I'm Robert Lefever, I'm the director of the Promis Recovery Centre. What we're hoping to do with these short clips is to help people to understand the nature of addiction and what can be done about it. Relapse. You can't relapse unless you're in recovery. It takes 2 years to do step one, to recognise that I really am an addict. And my life is unmanageable and I need to do something about it. That process takes 2 years. Now we help people here to get familiar with the steps, but that's all we're doing. Promis is a university. We're not a hospital. We don't operate, take out the bad bit, throw it away and then sew up the wound. We're a university. We teach people. We say, that's a hole, this is a shovel. You dig holes with shovels like that. Now you try. That's what we do here. We're helping people to understand the 12 steps, but actually doing it has to be done out there. They have to do it themselves, in the fellowships, in Alcoholics Anonymous, Narcotics Anonymous, Overeaters Anonymous. That's where they have to actually do the steps and put them into practice in their real lives, not in an artificial environment, such as a treatment centre. You can do it here, you can comply, you can do, finish up with a medallion and all the rest of it, go straight out and relapse. Unless you really take it on and do it, which is what we need to do. The way that addiction, depression progresses, our mood, our behaviour, and the consequences of the behaviour get gradually worse, not on a straight line, which would be easy. If you had 1 point there, 1 point there, 1 point there, well, you know where the fourth one's going to be. It's going to be there. It'd be easy to see what we were dealing with. But it doesn't go down like that. It goes down in a wavy path like this. And that's very confusing, because at times things are getting better, and at other times they're not getting particularly worse. Now that's very confusing for families, very confusing for us. We don't understand what we've got. But it's only because it goes down a wavy path like that, not a straight line. What we have to recognise is to average it out like that, and you'll see the overall effect is down, even though there are these fluctuations. And then the other thing we need to do is to see that each crisis gets progressively worse, and that the time interval from one crisis to the next gets progressively shorter. So something that used to happen every 2 years then happens every 6 months, and then happens every couple of weeks. The crisis interval gets progressively shorter as we go on. Recovery begins with abstinence, and we still have the mood fluctuations like that. It goes up and down. At this point, we say to ourselves, I don't need the 12-step program, I'm doing fine. I don't need any of this rubbish. Over here, we say, the 12-step program doesn't work, I feel miserable, I'm doing everything you asked me to do and I'm still feeling miserable. Again, what we have to do is to average it out, like that, and see that these fluctuations are part of normal recovery. And they gradually even out as we get further into recovery. At this point, when we've been going a few years, we say to ourselves, I'm okay, it was my mother, it really was my mother, it wasn't me, I'm fine, I'm okay, it was my mother's fault. And so what we do is to stop going to meetings, stop working the steps, dismiss our sponsor, and all that happens is that we go back to this curve here. Now, at that stage, below that line, we're drinking or using drugs or going back to binging, vomiting, starving, all the rest of it. And then people say, he's relapsed. That is not true. We relapse here. That's when we stop using the treatment for the depression. This is when we just pick up another treatment. This is when we stop doing that and go back to what we did before. Now this particular point between there and there is very interesting. It's called the dry drunk. And those people are not using the treatment for their depression. and they get very, very angry. I don't drink. You hear me? I don't drink. What more do you want of me? What you're seeing there is addiction in its purest form. All the anger, all the resentment, all the blame, all the self-pity. That is addiction in its purest form. That is what we need to get rid of. That's what this treats. So the relapse, you've got to get into it first. You've got to get into some sort of recovery. But then the relapse begins as soon as we stop using the treatment.